So our next speaker will be presenting on the impact of trauma as it relates to child well-being. The next speaker is April Lott, who is a 14-year employee of the Directions for Living and serves as the president and chief executive officer. Ms. Lott is a licensed clinical social worker with more than 3 decades of experience in understanding co-occurring substance use disorders, mental health disorders, trauma, and domestic violence. Prior to joining Directions for Living, Ms. Lott served in a variety of service and leadership roles within the human services industry, including serving as the CEO of a large not-for-profit residential program for abused and neglected children, serving as the principal for 5 alternative education schools, working as a protective investigator and probation officer, and operating also as a private practice. Ms. Lott serves on the statewide Florida Child Abuse Death Review Committee and the statewide Florida Critical Incident Rapid Response Team. Additionally, Ms. Lott is the co-chair of the Pinellas County Continuum of Care for the Homeless and the chair of the Continuum of Care for the Homeless Providers Council, and the chair of the Pinellas County Crisis Intervention Team Collaborative. Ms. Lott is a certified trainer in mental health, first aid for adults, youth, and first responders. Ms. Lott currently manages more than 20 mental health first aid instructors and is committed to developing a small army of everyday people who can recognize the signs and symptoms of a mental health condition and connect people to the resources they need. Ms. Lott received her master's degree and bachelor's degree in social work from Florida State University. Ms. Lott is the recipient of the 1989 Joanne Gorman Award for her outstanding clinical work with children impacted by trauma, the 2008 National Alliance on Mental Illness Iris Award winner for her cooperation and commitment to provide support and services to people with mental illness and recovery, and the 2010 Pinellas County Sheriff's Office Community Leadership Award, and finally the 2017 National Alliance on Mental Illness Leadership Award. It's our pleasure to have you here today, Ms. Lott. We thank you and we look forward to your presentation.
Thank you. Thank you so much for that introduction. I'm going to go ahead and share my screen and we'll get started. So we are talking about the impact of trauma on family functioning and child well-being. We're going to try to get this done in about 20 minutes or so and then leave time for questions and give me an opportunity to respond with answers. As you know, this topic is pretty big. So we'll jump right in. Oh boy. Yeah, so the solution for all adult problems tomorrow depend in large measure upon the way our children grow up today, by Margaret Mead. I think that really just covers exactly what it is that we're trying to really influence through our work, which is that the way we care and support and protect our children really forms how they become as adults, and then all the problems that flow from there. This screen I'm leaving blank, but I do just want to say to all the attendees that if you have not watched the Dr. Nadine Burke TED Talks, I want to encourage all of you to do that. It is about a 15-minute TED Talks that really talks all about ACEs. So I'm going to spend just a few minutes talking about ACEs, which really is about the trauma and how it impacts our children and families. ACEs, as hopefully all of you have heard the term before, stands for Adverse Childhood Experiences. It really is the term that's given to describe all types of abuse, neglect, and other traumatic experiences that occur with children, to children, experiences of children before the age of 18. Sometimes it is also referred to as toxic stress or childhood trauma. ACEs really encaptures all of those things. If you haven't taken the ACEs, I would encourage everybody who's listening here today to take the ACE, to know your ACE score. There are 10 questions. What some people don't know about ACE is that it started as an obesity study. Out in California. There were approximately 26 adults who were asked to participate. About 17,000 of those did participate. The thing that was particularly interesting about the ACEs in that initial in that initial survey was the people that were included in the ACE study. Because it was an obesity study, it was really being done by Kaiser Permanente, which is a health plan out in San Diego. It was confidential, but the demographics of the people who were participating are really noteworthy. They were obviously they had a doctor. They were in a primary care setting. They were educated. The vast majority of them had a college degree. They were middle class. They were predominantly white. They had health insurance as a result of their education and their employment, and the average age was 57. The reason that is important is because we often hear about, when I was in school, for example, we were often kind of talked to and educated about the risks for people who were the opposite of that group. People who were considered high risk of bad things happening to them were people who were poor and people who were in the Black and brown communities or minority populations, and people who were uneducated, people who didn't have jobs. All of those were the people that groups of people that we were told were the people who were at risk. And what the study showed to us actually was that all of us, it is all of us who are at risk. The ACE experience really initially was looking at people who weren't in those high risk categories because they were educated, they had jobs, they had insurance, they had access to health care, they were two-parent households, those kinds of things. So that's important as we move forward, because there really isn't these two groups of people, if you will, which is, those who are uneducated and or poor, and the rest of the population. It really is all of us who are at risk of experiencing childhood adversity. So the ACEs looked at three separate categories: abuse being physical, sexual, and psychological; neglect being emotional and physiological and physical. And then the third was, of course, the exposure to traumatic stressors such as substance abuse, divorce, mental illness, someone like a domestic violence happening within the home, and criminal behavior, someone going to jail. So what we know about ACEs is that they often last a lifetime. But the thing that I want to make sure that I say here today is that they don't have to. Healing can occur, the cycle can be broken, and safe, stable, nurturing relationships are possible, and protective capacities can be formed. So childhood experiences can be powerful determinants of who we become as adults, both the good and the negative. So how do ACEs affect our lives? Again, knowing your ACE score can be very helpful as just as a piece of data, something that is helpful to know about yourself. What we certainly know about ACEs is that there is a dose relationship. The higher your ACE score, the more likely some of these things are to happen. It's not a for sure, but the more likely some bad things are to occur in the life of that adult as a result of their early childhood experiences. Again, the ACEs is a score of 0 to 10 for individuals who have experienced, for example, physical abuse or witnessed domestic violence or had parents who were divorced. Their score may be a 3. Depending on how many of those experiences you have would determine your score. What we know is that trauma is the leading cause of all of these things. What I think that the majority of you might find interesting is the list on the left. We have long since been told that when bad things happen to kids, the list on the right, depression, mental illness, smoking, alcohol, and drugs, we've long since been taught that if bad things happen to children, these outcomes could be likely. alcohol and drug abuse, depression. What we rarely hear about, however, is this other list, which is morbidity and mortality and disability, cardiovascular disease, chronic lung disease, chronic liver disease. What we know now about early childhood adversity is that it also affects our physical health. And in doing so, what we can see is a correlation between high ACE scores and high death rates due to physical health conditions such as COPD, heart attacks, chronic lung disease, and those kinds of things. So people with 4 or more ACEs compared to those with 0 ACEs, as you can see here, these are the risk factors. So if you are working with a parent and or children, by the way, we work with children who are 1 year old with ACE scores of 4 or more. We work with 6-month-old children who have ACE scores of in the range of 8, 9, or 10. So please know that even if children are really, really young, they can have very high ACE scores. And so what we need to do in response to that with these children, as you know, is we absolutely have to increase the protective capacity and the protective factors that surround those children. In any case, what you can see here is that if a child has 4 or more ACEs, they are 242% more likely to smoke. They're 357% more likely to experience depression. They are 1,133% more likely to abuse IV drugs. They are 1,525% more likely to die or attempt to die by suicide. And in the end, 555% more likely to experience alcoholism in their adult life. Now, these certainly aren't predictors necessarily to say that if someone has an ACE score of 4, this for sure is going to happen. It really is a percentage around the likelihood of something happening. And the reason I point this out is because we already have children, very young children, who have very high ACE scores, which means we really need to be talking about suicide, for example. We really need to be talking about alcoholism and drug use and mental health, such as depression and anxiety. For those of you who are interested, there is an economic toll to trauma and the impact of trauma on family functioning and just the stability of our communities. The CDC estimates that a lifetime cost associated with child maltreatment is $124 billion, broken down by the loss of productivity, the cost of healthcare, the cost of special education, child welfare, and criminal justice. So probability of outcomes given 100 American adults, again, just another way to look at it. If we had, of that 100 American adults, 33 of them had no ACEs, so they had a 0 score, 1 in 16 of them would smoke. If they had a score between 1 and 3, 1 in 9 of them would smoke. If they had an ACE score between 4 and 8, 1 in 6 would smoke. So you can see then the relationship, is dose related, but you can also see that somebody with no ACEs certainly still can be at risk of a variety of things, such as abusing or misusing alcohol, 1 in 69, whereas with 1 to 3 ACEs, 1 in 9, and with 4 or 8 ACEs, 1 in 6. So you can see as we go down the list here, with suicide, 1 in 96, if you have 0 ACEs, would attempt suicide, 1 in 10, with an ACE score of 1 to 3, and with 4 to 8 ACEs, 1 in 5 would attempt suicide. So we really can see that the higher the ACE score, the more likely things are to go wrong in the life either of that child as an adolescent or young adult or in adulthood. So how do we join the movement? When you listen to Dr. Nadine Burke on the TED Talks that I really hope that you'll listen to, she talks about the movement, joining the trauma-informed care movement. I hear a lot of people who talk about being trauma sensitive, being trauma informed, and yet I'm not seeing the behavior, the policies, the procedures, the programming that really supports being trauma informed. So what I would absolutely say is that it starts with you, all of you. No doubt all of you are here today because you're already working to serve and protect children. We really need to get this message out to all the people in our communities who aren't already within the movement. We need to identify and understand the importance of protective factors. We really do need to understand that we can minimize and immunize our kids against the effects of ACE. In my organization, we talk about things like plus one. Plus one is language in our organization that really means we've added to that ACE score. Sometimes adding to the ACE score is inevitable. It is the lesser of two evils. For example, a parent going to jail is an increase of 1 point in an ACE. Sometimes a parent has to go to jail. But we need to understand up front when we make decisions related to children that we sometimes are making decisions to increase their ACE score. And when we do so, we need to do so intentionally. And then we need to add all of the protective factors and protective capacities around them because we've just increased their ACE score. We can and we must reduce the numbers of ACEs for our children. We need to get pediatricians involved. We need to get family physicians involved. We need to get school professionals involved. Everybody needs to know how to be sensitive to plus ones and how to reduce the numbers of ACEs in children. One of the things that I want to make sure everybody here knows about, well, what can we do? One of the things that we can do really is listening to our parents who were once children story. Certainly listening to the story of the children is absolutely important in protecting them. But what we also need to understand is that we need our parents, as dysfunctional as they are, we need our parents to care for and love their children. We can't remove everybody's children. We don't have enough places for everybody's children. Even if we did have enough places for everybody's children, it's not in everybody's best interest to separate children from their parents. One of the things that we know for sure is that research shows that just asking about ACEs significantly reduces their need for doctor visits and for treatment. Literally, just allowing our adults to tell their story of their own childhood adversity when they were children increases the likelihood that they can protect their own children. So one thing that we all should be doing, depending on, of course, on our roles with parents and children, is asking them to tell us their story. So there are 10 essential elements. I'm going to run through these really quick that I think we all should be using. The My Child principle, which is that if we're working with children, how would we want our own children to be treated? So if this was my child, how would I want this child to be treated? If this were me principle, so if I were the adult under investigation or the adult who was receiving services, how would I want to be treated? The what happened to you principle as opposed to what's wrong with you principle. I'm assuming all of you are familiar with that, but asking people what's wrong with them is not helpful, but rather what happened to you. Tell me your story. Obviously, comprehensive case management is absolutely critical to the success of developing protective capacity skills in our parents. The one agency initiative, getting rid of the silos that we are all working together. And then, of course, staffings are incredibly important, especially around critical junctures, individual and family support, face-to-face case management, specially trained case managers and small caseloads, and data analytics and early warnings. These are the things that we really need to do if we are going to reduce the number of child fatalities due to abuse and neglect in understanding ACEs and family functioning. So protective factors, I'm assuming all of us are familiar with protective factors, but just to kind of go over them again so everybody understands what I mean by protective factors, nurturing and positive relationships. I have to tell you that the research on a single positive relationship in the life of a child is the research is sound, it is solid. Literally, a single positive, consistent adult relationship in the life of a child can make the difference in their adulthood and whether they succeed or don't. So honestly, if we do nothing else, having a positive adult relationship in the life of children is something we should be focused on. And if it can't be us, getting children connected to a godparent, a support system at the school, a teacher, but a positive relationship is life altering. Knowledge of parenting and child development, parental resilience, helping our parents again to get stronger by addressing their own childhood trauma histories, social connections, and concrete support in time of need. Our parents right now need to be able to call someone and say, "I need help," as opposed to the shame and the blame and hiding those things that ultimately can harm children. And then, of course, building resilience, recognizing early signs of stress and connecting people to resources, developing a trusting relationship and provide support. And of course, looking for points of strength. We really need to be strength-based, even with some of our most dysfunctional families. There is so much strength within them. And if we highlight that strength and develop that strength and build on those strengths, we really can make a significant difference in the lives of our children. I will say here that I think everybody listening today should take a mental health first aid course. It's an 8-hour course. You can find them in your community, often for free or no cost. And I would encourage everybody to take a mental health first aid class, simply because it helps you to recognize the early signs of stress and connecting people to resources before a mental illness has occurred. Simply a mental health condition that is worsening really needs someone to recognize those early signs and to connect people to resources. And we really could prevent and avoid a whole lot of abuse, neglect, and ultimately tragedy. So that really brings me to the end of the presentation. These are some trauma-specific interventions that I would encourage you to learn about. I hope that maybe you'll take a screenshot of this. The thing that I hope that you will do, if nothing else, is, of course, to watch the Dr. Nadine Burke TED Talks. It really is quite impressive. In 15 minutes, it will help you to see truly the impact of ACEs on family functioning, in particular on mental health and the development of mental health conditions, on the use of alcohol and alcohol abuse and drug addiction, and ultimately, of course, physical health conditions and dying significantly earlier in their adult life had they had lower ACE scores. So that concludes my presentation. Let me see if I can stop sharing my screen and move to questions.
And again, please utilize the chat feature for any questions that you have for April. April, is your contact information located on the?
I believe that it is. I can certainly provide it.
Yeah, if you want to just drop it in the chat so everyone
Okay.
can have your information. That way we can contact you if there are any questions.
Okay. I've put my email address there, so if anybody wants to reach out to me, I would say obviously that a topic such as this would benefit from, a 2-hour or a 3-hour, full presentation. But certainly this is enough to get people started around understanding the impact of trauma on family functioning.
Certainly, and we thank you for for just sharing your expertise and of course for your continued advocacy as it relates to mental health and these and the ACEs and just the impact that they have on overall well-being. I urge you all to, to consider the 10 essential elements and of course the protective factors even during your review meetings. The theme of our last, which was 2019 CADR Summit, was the protective factors. So, just for April to highlight the importance of those again, I just want you all to please just keep those in mind as you go through these reviews and you develop these prevention initiatives. Definitely want to keep the essential elements and protective factors in mind. But thank you, April. We very much appreciate all that you do for us, like you, and for the children, importantly.